The most common cause of non-bacterial epidemic viral gastroenteritis in adults worldwide is this norovirus calliciviridae. Adenovirus serotypes 40-41 classically produce acute gastroenteritis in age group infants and young children, 2 years. Prion PC, to conformational change with beta-pleated sheet accumulation, is the pathogenetic hallmark of DOT diseases. Prion transmissible spongiform encephalopathies. Kuru was transmitted among the South 4 tribe by ritualistic passing out, cannibalism, endocannibalism. The licensed live attenuated Japanese encephalitis vaccine in India, SA-14-14-2, is produced in cell line, primary hamster kidney cell. Barnyard mosaic pattern on liver CT plus high ALT/AST in pregnancy should prompt suspicion of fulminant hepatitis caused by virus genotype 1, hepatitis E, HEV1. Sofosbuvir is a nucleotide analog that inhibits the NS5B RNA-dependent RNA polymerase of some virus, hepatitis C. Human papillomavirus, HPV vaccination schedule in India for girls aged 9 to 14 years is 6 doses at 0 and 6 months. 2. High-risk HPV oncogenic proteins E6 and E7 inactivate tumor suppressor genes respectively, P53 and PRB. For post-exposure varicella prophylaxis, acyclovir must be started within 2 hours of contact if VZIG is unavailable, 72 hours. Adenovirus vaccine types 4 and 7 given to U.S. military recruits is administered by the route oral enteric-coated tablet. Live 17D yellow fever vaccine is contraindicated in infants X months, 9 months. Coxsackie A16 and EV71 are the principal etiological agents of disease. Hand, foot, and mouth. Positive sense RNA viruses replicate in the cytoplasm, except which replicates in the nucleus. Influenza viruses were the Myxoviridae. Exercise-induced asthma can be precipitated by intake of AstraZeneca vaccine in aspirin-sensitive individuals. Live intranasal influenza, LAIV. Negri bodies in cytoplasm of infected neurons stain intensely with ratio dye, eosin. They are eosinophilic. Hendra and Nipah viruses are transmitted from their natural reservoir, bats. Terrapid fruit. ELISA detecting P24 antigen shortens the serological window period of HIV infection to about days, 15 to 18. Transplacental infection with rubella virus before 12 weeks gestation most commonly causes X defect in the infant. Sensorineural deafness. Inactivated polio vaccine IPV induces high serum IgG but negligible at mucosal surfaces, secretory IgA. The dengue NS1 antigen is reliably detectable in serum up to day 7 of illness. Acyclovir requires initial phosphorylation by the viral enzyme pinase present in HSV-VZV. Thymidine. Colchicine-like drug E is the first approved oral agent for SARS-CoV-2 protease 3CL inhibition. Nirmatrelvir, boosted with ritonavir. A positive Paul-Bunel heterophile antibody test with titer greater than 1 to 128 indicates acute infection with virus. Epstein-Barr, EBV. Nasopharyngeal carcinoma in Southeast Asia is closely linked to latent infection by EBV type X. Type 2, or EBV1. CMV retinitis in AIDS is treated with induction ganciclovir, 5 mg kilogram IV, every 12 hours for 14 days. Parvovirus B19 causes aplastic crisis in patients with chronic hemolytic anemia because it selectively destroys excess precursors, erythroid pronormoblasts. Genome of HBV is partially double-stranded circular DNA relaxed. Congo-Crimean hemorrhagic fever virus belongs to the num-num family, Nairovirus bunyaviridae. A satellite RNA virus that depends on HBV surface antigen for its envelope is WO virus, hepatitis D, HDV. Adeno-associated virus serotype 2, AAV2, is widely used as a vector in Y therapy. Gene. Marburg virus incubation period ranges from days after exposure, 2 to 21. ELISA kits that detect rotavirus VP6 antigen in stool are based on WRD1 antibody format. Sandwich monoclonal. Polyomavirus JC causes demyelination because it infects cells of CNS, oligodendrocytes. Live attenuated intranasal influenza vaccine is of some type, cold-adapted, temperature-sensitive. LAIV-CA, cold-adapted. Swine flu pandemic 2009 strain carries hemagglutinin subtype, SUP, and neuraminidase subtype 1, H1. ICSN algorithm recommends a third rapid ELISA test with divergent antigen or principal when the first HIV tests are reactive in India. 2. Oral valganciclovir achieves systemic exposure equivalent to IV milligrams per kilogram ganciclovir. 5. The breakpoint titer for protective neutralizing antibody after JE vaccination is greater than or equal to 1 to 10. High-dose ribavirin is combined with interferon alpha for treatment of virus infection in hemorrhagic fever outbreaks, Lassa. Arbovirus transmitted by Haemococcus mosquitoes in Brazilian forest cycles is fever virus, yellow. Virus-induced oncogenesis by HTLV1 involves activation of the cellular AL gene via TAX protein, NF-kappa B, I-kappa B pathway. HBsAg screening of donated blood uses chemiluminescent microparticle immunoassay with sensitivity 0.05 IU per milliliter. The Ebola GP glycoprotein is the target of monoclonal antibody cocktail approved in 2020. REGN-EB3, Inmazeb. JC virus reactivation causing PML is most commonly triggered by therapy with monoclonal antibody XX, natalizumab. Croup in infants is caused by parainfluenza virus serotype 1, type 1. Polymerase acidic endonuclease inhibitor baloxavir marboxyl is effective against influenza strains A and B. Foscarnet is a pyrophosphate analog that directly inhibits viral DNA polymerase of CMV and HSV when TK deficient. Glycoprotein D is the main neutralization antigen of viruses, herpes simplex. Sabin OPV-derived CVD-PV outbreaks are prevented by replacement with novel OPV type 2, NOPV2, carrying stabilized ground region. Domain V, in 5' UTR. SARS-CoV-2 VMC Omicron BA1 possesses more than mutations in the spike protein, 30. Monkeypox presents with lymphadenopathy, differentiating it clinically from classic lesions. Smallpox, variola. The prion disease variant CJD is linked to consumption of beef infected with, encephalopathy agent, bovine spongiform. Koplik spots appear in the prodromal phase of infection, measles. Post-exposure prophylaxis for measles in an unimmunized infant under 9 months uses MMR vaccine within hours, 72 hours. Rubella virus genome is single-stranded S-sense RNA, positive. Coxsackie B virus can produce pluridynia, also called disease, Bornholm. ELISA for anti-HBC IgM is used to differentiate acute from HBV infection. Chronic carrier, resolved. Sample of choice for rabies RT-PCR antemortem is full-thickness nuchal skin biopsy containing X, hair follicles with nerve endings. Hepatitis B e antigen seroconversion during therapy indicates loss of phase replication, immunactive. RSV prophylaxis in high-risk preterm infants uses humanized monoclonal antibody AM monthly during season, palivizumab. Neutralizing epitopes on RSV F protein are maintained in pre-fusion conformation, stabilized in vaccine candidate. RSV pre-F, Arexv, etc. CMV-UL54 gene mutations confer resistance to both ganciclovir and antiviral foscarnet. Zoster vaccine live is administered subcutaneously as a single dose of 13 PFU, 14,000 PFU, ZVL. PrEP for HIV infection uses fixed-dose combination of tenofovir disoproxil 300 mg and 200 mg, emtricitabine. Window phase HCV core antigen assay can detect infection roughly X weeks earlier than antibody ELISA, 2 to 3 weeks. Oxvirus replicates in viral cytoplasmic factories visible as inclusions called bodies, Guarnieri. Live attenuated varicella vaccine strain is designated Oka-Merck. For chronic HBV with compensated cirrhosis, first-line nucleoside analog per WHO is tenofovir disoproxil fumarate. Rotavirus VP7 defines G-type. Indian Rotavac is G9P recombination. P11. A positive tank smear demonstrates multinucleated giant cells in vesicle fluid of infections. HSV, VZV. True/false. Parvovirus B19 is resistant to lipid solvents because it is non-enveloped. True. Immunoscape E antigen negative mutant HBV typically harbors a stop codon in the whatever gene. Pre-C. Crimean Congo hemorrhagic fever is diagnosed by detecting viral RNA from EDTA blood using real-time assay. RT-PCR. A recombinant subunit R21 matrix M malaria vaccine uses hepatitis B surface antigen as carrier forming the particles, virus-like. Lassa fever reservoir rodent is multimammet rat, Mastomys natalensis. A single-dose live attenuated vaccine RVSV-ZBOV is used against colon virus, Ebola Zaire. Oncolytic immunotherapy uses modified HSV-1 strain telemogene laherparepvec expressing cytokine GM-CSF. Herpes B virus, circopithecine, infection in humans is acquired from bite, macaque monkey. B19 infection in pregnancy can cause fetal hydrops by inducing severe anemia. Aplastic. Salk IPV, currently used in UIP India, is administered as fractional 0.1 ml intradermal at 6 and 8 weeks. Genome reassortment between two segmented viruses is termed influenza antigenic shift is an example. Genetic shift reassortment. Rabies PEP. Equine RIG dose is 40 IU kilogram. Maximum volume infiltrated around. Should cover all wounds. Bite site. Breakthrough varicella. Over 42 days post-vaccine with less than 50 lesions is termed varicella, modified mild. Foulpox virus with GP gene insert is an example of vector vaccine platform, recombinant viral. Crimean Congo HF virus belongs to genus Orthoneurovirus and has trisegmented orthosense RNA. HTLV1 is transmitted via cell-associated virus in blood, sexual contact, and prolonged feeding. Neutralizing antibody titer greater than 0.5 IU milliliter 14 days after second dose of rabies vaccine indicates immunity. Protective. Lymphocytic choriomeningitis virus, LCMV, reservoir is the common mouse, House, mus musculus. Senecavirus A infections mimic foot and mouth disease in animals but are not zoonotic. Swine, pigs. Paramyxovirus genome length must be multiple of 6 for efficient replication, termed the 6 rule. Zoster recombinant subunit vaccine RZV Shingrix contains adjuvant AS01B made of MPL and extract of Quillagia saponaria QS21. Rabies monoclonal antibody combination marketed in India is brand name Rabishield, SII-RMAB. Measles virus belongs to genus within Paramyxoviridae, morbillivirus. The earliest serological marker to rise after dengue infection, besides NS1 antigen, is IgM anti-DENV detectable by day 5. Icosahedral capsid symmetry with no envelope is characteristic of virus family, e.g., rhinovirus, Picornaviridae. The diagnostic mulberry-shaped intracytoplasmic inclusions in Molluscum contagiosum are called bodies, Henderson-Patterson. Genome editing CRISPR-Cas9 was originally derived from adaptive immunity in viruses. Bacteriophages infecting bacteria. YF17D vaccine must be stored at less than 20 degrees Celsius. Once reconstituted, it must be used within hours. 1 hour. Varicella in pregnancy, weeks 13 to 20, carries 2% risk of congenital VZV syndrome that includes limb defects, hypoplasia.